my name is Dr. Ace McGurl. I'm a holistic fitness coach, physical therapist, speaker, author of the book Connect the Body Dots, and welcome to my Masterclass Connected Core Mobility in Life and Fitness. This is going to be a holistic approach to help you reduce pain, improve your health, improve your fitness, and confidence in your entire body so that you can be the best version of you. A little bit about me. I am a mom, a business owner. I call myself an athlete. I'm a fitness athlete, and I dabble in a few other things. And I love bodies, and I love teaching people about their beautiful bodies. Though it may not feel beautiful at the time, I want to teach you guys to be able to love your body in every which way because our bodies are so amazing. You probably have a reason why you are here today. You clicked on this video, this masterclass, because maybe your back hurts, maybe your neck hurts, maybe you know the reason why you're here. But oftentimes I ask people, how are they feeling? And they have this one blatant thing that's bothering them. Well, there's a whole bunch of other little fires going on in our body. So I want to bring awareness to, yes, the reason that you're here, but all these other little things that are going on in your body potentially at the same time, or you struggle with them in the past and you're afraid that they're going to come up again. Now, I might call you out, but I'm going to call you out of love, just so that we're able to bring awareness to some of these things that might be silently affecting our life. And of course, after this, I'm going to show you what you can actually do about it. Biggest reason. Does your back hurt? Did you do some yard work over the weekend, or you had some friends coming over, so you cleaned your apartment, cleaned your house frantically, and now your back hurts? Maybe you're having a sciatic nerve flare up, a disc herniation flare up. This is something that you've dealt with in the past, and you feel like this is something you're just going to have to continue to deal with. Or you've actually been to the doctor, they've diagnosed you with sciatica, they've given you an MRI, and they've shown you, oh, this is here, this is terrible. Either you're going to have to get injections or surgery, or you're just going to have to deal with it. Or you don't have a diagnosis, you don't have any imaging, but your back is just tight all the time. Maybe you are an active gym goer, but your back is just tight all the time for no reason. Like, this is your new normal. Is your neck tight? Stiff? You're like this all day. Or you wake up in the morning and you must have slept wrong, and you sleep wrong pretty often. So you're struggling with a stiff neck all the time, maybe even a headache or some brain fog with it. And in order for you to make it through your day, because how do you even think with your neck all tight, with your brain all fogged up, with pain in your head? How do you think? So you take some medication just so that you are able to make it through your day. Do you have no energy? You feel like you have the weight of the world on your shoulders. You are exhausted, like you're running a marathon, but you can't keep up. Or you should be, because you really don't sleep all too much, but you're running off of so much caffeine, you don't even feel it. You have your cup in the morning, cup in the afternoon, cup later in the early evening. And then when you get to bed at night, it's like you're tired, like you know you should sleep, but you can't really sleep. And then when you do sleep, it's not good quality sleep. It's like you're tired, but wired. And then you wake up the next day and you're still tired. So you continue the cycle over and over again. Is your belly bloated? Like all the time, like you can't poop, or you feel like you're just distended all the time. Did you know we're supposed to poop at least once per day? And after we poop, we're supposed to feel some relief. And so many of us don't even think about our poop. Poop is so important. Have you ever started your day and you're like, oh, I just don't feel good? Like you don't know what's wrong, like nothing's really wrong, but you just don't feel good. And then you go to the bathroom and you're like, oh, all it was is I just had to poop. We are supposed to poop every day, sometimes multiple times a day, depending on who you are. Do you have to go to the bathroom all the time? Like when you put the key in the door or you turn on the faucet, you immediately have to book it. Sometimes you make it, sometimes you don't. There have been maybe instances where you peed your pants a little bit. Or maybe you are a mom getting back into working out, and it doesn't happen with the faucet or putting the key in the door or your everyday activities, but you might pee a little bit when you lift, when you run, you jump. Or you feel this heaviness or this dragging sensation in your pelvic region, and you are absolutely afraid to run, to jump, to sneeze because you feel like something's actually falling out of you. Let's talk about the bedroom. Does it hurt? Don't want to do it for women. Can't get up, can't keep it up. And you notice this is causing some tension between you and your partner. Not like this coming together tension like you'd want during intimacy, but like this repelling tension, and this repelling tension sparking little arguments, maybe a little bit of resentment here and there. Are you sad and depressed, but you're going through the motions because what else is there to do? And if this is you, if you just keep going, I want to applaud you for just keeping going. And I'm such a big advocate for mental health. But oftentimes we don't address the physiological component of this. And that's a part of what we're going to get into today. Are you anxious and worried? Anxious and worried about the 10,000 things on your never ending to-do list. Every day there's something new on there. And it's like you can't keep up. Are you anxious and worried about your health? You have all these random symptoms that just keep popping up. Oh, my eye hurts. Like, what? Why is my eye hurting? Oh, I have a rash. Like, why is my shoulder hurting? Why is my knee hurting? What's going on with my foot? I didn't even do anything. Why is my foot hurting out of nowhere? And when you go to your doctor's office, they're looking at you like, that's normal. There's really nothing we could do about that. Or, here, you want to try this medication without addressing why this is happening in the first place. Or they're thinking about imaging, thinking about injections, thinking about surgery. Or my favorite one is they're looking at you like, oh, it's you again? Like you're here every other week. Like what is going on? They're looking at you like you're crazy. Why am I asking you this? Why am I calling you out? All of these things are signs that your mobility and core might need a little bit of help. I'm not saying that this is the entire issue, but this is often something that is highly neglected. We're going to discuss how you can address all of this so that you can live your life with confidence in your body. Why? Because you deserve to live your life with confidence in your body so that you could be the best version of you, with your body helping you rather than holding you back. I am here to teach you how much control you have over your body. These symptoms, to an extent, is our body just saying, hey, help me. And it is our job to listen, our job to connect to what our body is saying. And as the title of this presentation hinted, it is all about connecting with our core and our mobility. Now, I want you guys to meet my hardest patient, me. I am my hardest patient. All the symptoms that I mentioned, I've treated and worked with each of these over the course of my career. I've also experienced almost all of them, but differently at different points in my life. I've learned through extensive research, through working with hundreds, maybe thousands of people at this point over the course of my career, and my own frustrations with my sensitive body. I have been the girl at the doctor's office saying, this is wrong, this is wrong, this is wrong, this is wrong, and even holding some things back because so many things are wrong. And my doctor's looking at me like I'm crazy after going through all these tests that were normal. And it was scary and frustrating, but I'm so happy that I went through it because it made me question everything that I knew. I've always been into sports. I've always been into fitness. I have a medical background. It made me question everything, challenge everything, ask so many more questions, more and more questions. Guys, ask questions. I failed a whole bunch of times, but it's not failing, it's learning. It made me dig deeper. And it helped me finally understand my body, the human body, and all of our individual differences. And it brought me to where I'm here today, to help you learn from my mistakes, the mistakes of all the people that I worked with, the mistakes that are being perpetuated by social media and this extremely false standard. Sift through all this information that's out there and give you information that you can trust, backed by a skilled professional that cares and has been through it as well. I want to help you take control of your body. And it is more than possible because our bodies are so amazing if you just give it what it needs. Here's what we're going to go over today. Why core mobility exercises may not work for you. And I know it might be counterintuitive because that's the name of the presentation, but there's a little bit more to it. And that leads me to number 2, the missing link. The missing link is a little bit more to it. Number 3, how all of your symptoms connect. I threw a lot of random things out at you, and you're thinking, how the heck do all of these things connect? How does my lack of pooping connect to my foot pain? How does my headache connect to my rash? Like, how do all these things connect? Don't worry, we'll get to that. And then number 4, how to fix it. You're going to want to stay to the end to get to the how-to. I'm not withholding any information from you, but the information that you get leading up to the how-to is vital in fully understanding how to best help yourself. You will see so many how to do things, but they never explain to you why. And when we miss the why and kind of all the little intricacies of it, this is where we slip through the cracks. We each have this body, but so many of us don't understand it. We need more understanding of our body so that we know how to better take care of it. And that's what we're going to get into. At the end, I will offer you my 30-day holistic fitness and nutrition challenge. That is $197. But I say this now just to get that pressure out of the way so that you can fully absorb everything that I'm trying to teach you about your body. You are about to learn so much. You are about to get so many thoughts that you've always had the question to, but never knew who to ask. You're going to get so many answers today. And if you feel like you need my help at the end, I would be more than happy to help you, or you can my challenge. Why core mobility exercises may not work for you. All right, mobility exercises. Let me just define what mobility is. So mobility in terms of muscle length, it's just bringing a muscle through its full length, or it's bringing a joint through its full length. And we might do these because we might feel stiff a little bit. Maybe we're warming up. Maybe we're an athlete and this is what we've been taught to do. There's probably been, everybody that's on this presentation, you've probably done this toe touch stretch to stretch your hamstrings. You probably have done one of these in the morning. You probably did one of these before you're about to run when you're younger, you're about to race. So this is the stretch that you do when you're about to use your legs. Granted, this is a part of it too, but my point is we've all probably done these type of stretches, or maybe some other stretches, maybe some other mobility exercises. But here's the thing, with a lot of stretching that we're doing, we're just taking a muscle, cranking on it. It feels good for a while. And then usually the pain, the stiffness, it usually comes right back. And there might be a place for some of these things, but there's often something that's better. And we might just be throwing random stretches at our body when we're not really targeting where our body specifically needs it. What I found with most people, whether you are somebody who's generally really tight or somebody who's actually very flexible, like you could be flexible and have mobility restrictions as well. What I found is that most people have mobility restrictions in their neck, in their back, in their hips, at their foundation. And most stretches, most mobility exercises, they don't address this. So there's more to it. Core exercises. When people do core exercises, we do this because maybe we want to get that snatched waist. Maybe we want that 6-pack. Maybe you're doing core exercises because you know that it might help your back or your pelvic floor issues. And so we do crunches. So we do our ab machine. Maybe we do our leg lifts. Maybe we do our planks. And for some of us, it actually helps. We get the results that we're trying to get. And this usually happens maybe if you're younger, you have a little bit more free time, you're not as stressed, you don't have kids. But for a majority of people, these things might actually make it worse. You might be doing your core exercises to get rid of your back pain, but it's making your back pain worse. Or you're feeling it all in your neck, you're feeling it all in your hips. Or you're doing that specific exercise to target those lower ab muscles, but you just can't feel it. You're doing these exercises to snatch your waist, to make your belly a little bit smaller, but you're noticing you're actually getting wider. Your ribs are flaring forward a little bit more. Your belly is coming forward a little bit more. Your pelvic floor symptoms are actually getting worse. So why does this happen? So when we're doing these exercises, what we're likely doing is we're targeting our outer ab muscle, the rectus abdominis, that six-pack ab muscle. And along with this, we're likely targeting our neck, our back, our hips. And the problem is it neglects these deeper structures. It neglects our deeper core. It neglects our foundation. So though all these exercises, they may be good exercises, we want to make sure that we're addressing our foundation first. Okay, there are two houses here. Which one of these do you want to live in? The one that's on the flat land or the one that's on the hill? All right, just remember your answer. I think I know which answer you want, but remember your answer. All right, so back when I was a new grad, I had just graduated physical therapy school in 2017. I had started seeing patients at my first full-time job, seeing them for neck pain, back pain, foot pain, shoulder pain, elbow pain. I stopped at hands. I never touched hands at all different ages. And what I found is that almost all of these patients, they would get better if they just did some mobility exercises, some core exercises, and of course, strengthening, but we're going to kind of table that conversation for later. And at the time, I was a highly active person. I had come from my background in personal training, strength conditioning, so I was super into fitness. I ran, I jumped, I lifted, I did it all, as well as doing like my core mobility exercises. So I'm treating all these patients and they're getting better. But at the same time, I'm the active person. I'm doing what they're doing, but I'm struggling with foot pain, knee pain in both of my knees, back pain, neck tightness. I'd get to work sometimes after like my lift day, and I'd get to work with so much tightness in my back, and I'd be super anxious. And the only thing that would relieve it would be being cracked, having my back cracked by one of my coworkers. And this is not me saying that getting your back cracked is what's going to help you, but I'm saying after doing these exercises, like I felt so anxious, so stiff in my upper back. And there are times when I'd be doing my exercises, I'd be doing my lifts, and I'd be so nauseous that I'd actually have to stop. Even if I changed up my diet, like I'd be so nauseous in the gym sometimes that I actually had to stop. So what did I do? So I was very into like my strength training. I did a very hard regimen. And what I ended up doing was I had to switch to having to do a little bit more core mobility work. I'm not saying I stopped my strength training, but I focused a little bit more on my core mobility work. And my symptoms, they resolved. Like things got better. Like my foot pain went away, my knee pain went away, my back pain went away. Um, but what I found is as anything in my life changed up, like as things got a little bit more stressful, when I had my daughter, when I was working more hours, when I moved away from my family, when I started a new business, some of these things would pop back up. And why did they pop back up? It's because I never addressed the foundation. I was building a house on a faulty foundation. So I'm going to bring it back to the question that I asked you guys before is which house would you want to, which house do you like? Which house do you want to live in? The house where the foundation or the ground is nice and flat, the cement is smooth and the beams are up straight, or the house where it's built on a hill, it's crooked, cement's a little lumpy and bumpy. The house is literally going out in the opposite direction. And then as years go on, which house do you feel like is going to have a little bit more issues? The house on the hill, right? Because it was not built on a sturdy foundation. We need to address our foundation. And this is what I miss. This is what so many people miss, is we don't address this foundation first. So let's get to the missing link. What is this missing link? It is our deep core. We talked about this briefly in discussing core exercises. We need to address our deep core. Our deep core is our foundation of how we move. So within our deep core, we're going to have two balloons. So we think of deep core usually as abs, right? But really what our deep core is, it's like a water balloon in our belly. So the front of the water balloon, that's our deep abs, our transverse abs. That's the deepest, the innermost layer of our ab muscles. Our diaphragm, which is our primary breathing muscle, that's the top of the water balloon. The back of the water balloon, that's our deep back muscles. And the bottom of the water balloon, those are our pelvic floor muscles. All of these count as our deep core. It is not just six pack. It's not just abs. It is all of these muscles together, as well as our lungs and rib cage on top. All of these together, these are what I consider our deep core. So we have two balloons. We have an air balloon on top, our lungs and rib cage, and a water balloon on the bottom. And how these balloons sit on top of each other, this is our posture. This is our foundation. And this is what's often missed. So many of us are building a house. We're moving through our day. We're going through our exercises. We're building strength, but we're not addressing this foundation first. It provides your body with so much stability and the ability to move in all different type of directions, all which way. And as humans, we are creatures of movement. And this movement, this stability is needed for everything going on inside of us. Now, this deep core is connected to our breath. So many of you know that diaphragm is breath, and the diaphragm is the center of all of this. So in order to connect with our deep core, we need to connect with our breath. Our breath is the foundation of how we move. All right, so right here, we're going to be talking about normal breath. So many of us, when we think of breathing, we think of diaphragmatic breathing, good, but we think of diaphragmatic breathing as belly breathing. It's not belly breathing. When we breathe in, we're trying to get oxygen into our lungs, right? But our lungs are not in our belly. Our lungs are in our rib cage. So when we're breathing in, we want to breathe into our lungs and rib cage. Now, when we breathe in, our diaphragm, which rests right in the middle, is going to contract downward, and we're going to pull air into our air balloon. So our air balloon is going to get bigger. As our air balloon gets bigger, it's going to push downward on our water balloon. So our water balloon is going to get bigger as well. We're going to have lengthening through the front of the water balloon, the bottom of the water balloon, and the back of the water balloon. So you can picture as you inhale, everything expands and gets bigger. It is not just your belly. It is everything relaxes, expands, and gets bigger. Now, as you exhale, as air is being expelled, our air balloon is going to get smaller. As our air balloon gets smaller, it's going to lift up a little bit. It's going to lift off of our water balloons. It's going to lift off our water balloons. As we lift off of our water balloon, our pelvic floor muscles are going to contract upward. Our deep abs, our transverse abs, it's going to contract in this sequence: lower belly, middle belly, rib cage. And our back muscles are going to contract as well. Everything gets smaller as we exhale. As we exhale, this is contracting our deep core. As we exhale, this is contracting our deep abs. If you're struggling with pelvic floor issues and they've told you to do Kegels in the past, this is a functional Kegel, but it's getting your pelvic floor muscles to work with the other muscles in your body more effectively. Now, I just told you what is kind of going on inside of you. Like how do you feel this? Like, how does it actually relate to like what your body's doing? So I'm going to have you try this, and I'm going to show you how to do this as well. All right. So what you're going to do is you're going to breathe in through your nose. I'm going to be talking, so my mouth is going to be open, but keep your mouth closed. I want you to put one hand on your chest and one hand on your belly. This is just going to give you some awareness of what your body is actually doing. And I want to preface this by saying is you're not going to get this perfectly. You have been breathing a certain way your entire life. So if you do this one time, you might not get it right. It might take a few times to connect. Sometimes it takes a few days. Some people it takes a couple weeks. Everybody's a little bit different. But I say this now so that you're doing this and you're thinking, I can't get it right, so I'm just never going to do this again. Sometimes it takes a little while. All right, so you have one hand on your chest, one hand on your belly. I want you to sit up nice and tall. This is giving you a sturdy foundation, okay? Now, you will not sit up perfectly straight. You will not have this perfectly straight spine. We are human. We are human. We are not houses. So nothing's going to be absolutely perfect. But I do want you to have some awareness. So just sit up straight. Don't force anything. When we breathe in, you're going to take a breath in through your nose. What you're going to feel is air move into your chest, sides of your rib cage, belly, back, lengthening through your pelvic floor as you slowly, fully inhale. I want you to picture this as all of your balloons, both of your balloons, everything is getting bigger. Make sure your shoulders aren't coming up towards your ears as you take that breath in. Now, as you breathe out, you're going to get a slow emphasis on this slow, full exhale. As this happens, you're going to feel a lift of your pelvic floor muscles, compression of your lower belly, middle belly, rib cage. I want you to picture this as a lift and a zipping up type motion as you slowly, fully exhale. Okay, so you got your hands ready. You're sitting up nice and tall. Slow breath in. You're going to feel air move into your chest, sides of your rib cage, belly, back, pelvic floor. Slow, full exhale. You're going to feel a lift of your pelvic floor, compression of your lower belly, middle belly, rib cage. Picture this as a lift and a zip type motion. Full breath in. Everything expands and gets bigger and relaxed. Make sure your shoulders aren't coming up towards your ears. Relax your shoulders. Slow, long exhale. We're going to do 3 more. Full breath in, 360 expansion. Everything relaxes and gets bigger. Make sure you're not forcing anything. Slow, long breath out. Full breath in again, 360 expansion. Everything gets bigger. Relax those necks. Slow, long breath out. One more time. Full breath in, 360 expansion. Slow, long breath out. Okay. Though this breathing strategy will differ slightly depending on the activity and your particular goals, this breathing strategy is the foundation. And this breathing strategy can be applied to everything that you're doing throughout the day to help your body heal in so many different ways. All right, so I threw a whole bunch of symptoms at you in the beginning. Like, how do all these things connect? Like, how? Okay, one second. First, we got to get into like why these things happen. All right, diet. I'm going to really try to zip my lips with this because I'm really trying to stay on topic. Okay. If you want to learn a little bit more about this, please go to my book, Connect the Body Dots. I go through nutrition at the most basic level and at the deepest level to show you how nutrition is 100, 1,000, a million % involved in all of this. I'm not saying that nutrition is not, but I'm just trying to stay focused. So go to my book if you want to learn a little bit more about that. Sitting from work or school all day, never getting a chance to get up. We are creatures of movement. And if we're sitting all day long, we are doing our body a disservice. If we're sitting all day long, we're getting tightness in our neck, our back, our hips. And this tightness is a part of the problem. Stress. All right, take a breath. Stress is one of the biggest causes. Let's think about it. I'm going to describe maybe your day, maybe elements of your day. There might be a few things that you're able to pick out in here, or maybe this is your entire day. I hope this isn't your entire day because, whew. All right, wake up. crack it on. You are immediately out the door. Or you have to argue with the kids a little bit to make sure that they have everything all set for the day. Drink your cup of coffee, out the door, sitting in traffic, and you're mad because you're stuck in traffic. And then somebody cuts you off, so you're even more mad. And they don't even notice that they just cut you off. They're just on the rest of their day. You get to work and you're late and you're worried about your boss being mad at you because you're late and all the things that you have to do because you were late on top of the things that is already on your list. And you're trying to do all these things on your list throughout the day and you keep getting interrupted. Your phone, your emails, somebody keeps wanting to talk to you about something you don't even want to talk about. Like, I got things to do. Why you talk to me? You don't eat your lunch because you have all these different things to do. Later on in the day, your energy's dipping. So you throw back some more caffeine, or somebody made cookies, and because you didn't eat lunch, because you're a little bit stressed out, because your energy's dipping, you can't resist those cookies. So you have one, two, three. It's after work, time to go home. Maybe you gotta chauffeur the kids around, drive them from point A to point B. You get home, you gotta cook dinner, clean up a little bit, make sure everybody's ready for bed. And you get in bed and you're tired. Like, you're tired and you just want to relax. So maybe you're watching TV, maybe you're scrolling through your phone, seeing all these people that you should look like, places that you should be, things that you should be doing. Or you're checking your emails, trying to finish things up from work. And all of these things are stressing you out. Every single one of these things can be stressing you out. So maybe you could pick out a few things that I just said there, but all of these are contributing to more tightness and tension in your body. Improper exercise form, selection, programming. Exercise is great. I will never discredit that. But how we exercise can be a part of the problem in itself. So we each have some muscles in our body that might be a little bit more dominant, some that might be a little bit weaker. It's going to be different depending on the person. And because of this, we might go to do an exercise, but our form might be off. And if we continue to do this with bad form, we could just be training our more overdominant muscles. Now, if we go to load this maybe a bit too much, we could be training our more overdominant muscles to take over a little bit more and still neglecting our weaker ones. And then we do this on top of a lot of training, like we're training excessively, we're overtraining our more overdominant muscles and neglecting our weaker ones. Pregnancy and postpartum. Our country does a terrible job of the pregnancy and postpartum service to our mothers. During pregnancy, there's going to be this natural lengthening of our ab wall and our pelvic floor to accommodate our growing baby. This is why a diarrhea or a diastasis rectus abdominis is normal during a pregnancy. When these muscles are lengthened, it's going to put them in a weaker, more vulnerable position. So it is normal for these muscles to be a little bit weaker just to the position that they're placed in. But when we tell our moms, take it easy, don't exercise during pregnancy, this is where the problem comes in, because these muscles get weaker on top of that. On top of that, so many of us don't even know how to connect with these muscles in the first place. And then, because so many of us are taught, you got to snap back, you got to get back your pre-baby body really quickly. At 6 weeks, depending on who you are, maybe you are back into the gym, doing everything that you used to do. Maybe you're easing yourself back in because this is what the doctors tell us to do. We're easing back in, but things don't feel like they used to. And because things don't feel like they used to, maybe you're noticing pelvic floor symptoms. Maybe you're noticing back pain. Maybe you're trying to get the weight off, but it's not working. And maybe because you're trying to get the weight off, we develop so many hormonal issues because we're not doing it properly. Our moms need rehab and connection with these muscles. And when we don't get this rehab and connection with our muscles, we still got things to do. We still got kids to take care of. We still got a house that needs to be run. We still have to work. Maybe we are exercising. Our body's going to still do the task that it needs to, but it might do it in a way that is not as efficient. So we end up using our more over dominant muscles to be able to do everything that we're doing in our day. And whether or not you've had kids, I'm kind of tying it back to everyone, is if we don't address these things, things continue to get worse. We continue to use these muscles, tightness in our neck, our back, our hips, sometimes even in our belly. These muscles end up squishing our balloons. Our lifestyle causes our balloons to get squished in all different directions. Our lifestyle is causing our foundation to be off. And this is a problem. So many of us are doing things with a faulty foundation. Our faulty foundation is kind of like having our balloon squished. At the rib cage, when our rib cage is squished from our neck, our back, our hips, we want to get a full breath in. But because our rib cage is so squished, we can't get this full breath in. So we're not able to use oxygen appropriately. We're not able to use oxygen, which is needed for everything in our body. This could be a good reason why you're exhausted. You're not able to use the oxygen. This could be why you're fatigued. This could be why you're in pain. This could be why you're anxious. At the belly, we try to get this air in to our lungs and rib cage. And we ideally want to do this with our diaphragm. Our diaphragm is our primary breathing muscle. But when our balloons are squished, our diaphragm can't work as effectively. This is why I say, sit up nice and tall. This puts our diaphragm and our core muscles in a better position for them to be able to work. But when our balloons are stuck squished, we can't use our diaphragm as effectively. Still got to get the air in. So what we end up using is our more over dominant muscles to help us breathe to get the air in. Muscles in our back, our neck, our hips help us try to get the air in, but we don't do it as effectively. So when we take this breath in, what we end up doing is we end up squishing our balloons even more. And when we squish our balloons even more when we take this breath in, what ends up happening is we push our abdominal contents more forward and downward. Every time we take a breath in, we're just pushing our abdominal contents more forward and downward. This could be issues with reproduction. This could be hormonal issues. This could be gut problems. This could be your constipation. Because every time you take a breath in, you're just pushing everything forward. And I keep saying this, we are creatures of movement. We want good quality movement. We don't just want movement, we want good quality movement. This movement is needed for this back and forth, this rotation, this pumping type motion. But when we are so locked up from our neck, our back, our belly, our hips, we don't get this normal pumping motion, which is needed to get all this stuff through us. At your spine. So spine is going to connect your balloons together. It's going to connect your lungs. It's going to connect your deep core and your pelvis together. When our balloons are squished, our spine is squished as well. When our spine is squished, our nerves can get squished as well, some more than others. Within your neck, you have nerves that come out from your neck that go to innervate things in your shoulders, your arms, your hands. In your back, you have nerves that come out that innervate everything in your belly, your pelvic region, your legs, your feet. And when our balloons are squished and our nerves are squished, these nerves don't work as well as they're supposed to. This can be why things are in pain. This could be why you're getting numbness, tingling. This could be that sciatica. This could be why you're experiencing some weakness because these nerves are so squished. And when our foundation is off, it's going to throw off everything else as well. When our foundation is off, our shoulders aren't going to work like they're supposed to. Our hips, our knees, our feet aren't going to work like they're supposed to. Just because our foundation is off. This can be why you're experiencing some extra tightness in your thighs, contributing to your patella tendonitis. This could be why your calves are so tight, contributing to your Achilles tendonitis or your plantar fasciitis. Or when you reach over your head, you're getting a lot of this pinching in your shoulder. Or when you turn your head, you're getting a whole bunch of pinching in your neck or shoulder, or even things down your arm. We need to address the foundation. All right, I played with putting this in here, but I had to. a lot of information, I'm sorry, but I need you to see the entire picture. You're going to hear this a lot. Nervous system. Nervous system is the name of the game. Within our autonomic nervous system, we're going to have two branches. We're going to have our parasympathetic, which is our rest and digest. And then we're going to have our sympathetic, which is our fight or flight state. Due to all of these things that I talked about, our diet, sitting all day, maybe our workouts, maybe our stressful lifestyle, and even having our balloon squished, all this is going to tip us towards being in this more sympathetic state. And our bodies heal in this parasympathetic state. But due to our lifestyle, so many of us are tipped towards this constant sympathetic state all the time. And in order for our body to heal from so many different areas, all of those different symptoms, we need to allow our body to tap into this parasympathetic state a little bit more. And one way that you're able to tap into this parasympathetic state is our breath. Okay, how to fix it. Okay, number one, if you've been living this way for a while, you've had these tight muscles for years, you've been dealing with these issues for years, you want to address these tight muscles in your neck, in your back, in your hips, in your belly, maybe in other areas as well, because I'm talking about it from the foundation, but you can have these tight muscles in other places as well. This is where things like massages, foam rolling, dry needling, or even internal work if you're struggling with pelvic floor issues, all this can be extremely helpful to allow these muscles to relax, to let go, to allow you to unsquish your balloons. Now, this is a first step. If you just do these things, if you just do your massage, if you just do your internal work, you might feel better, but you might just feel better for a time period and things might go back to normal because you don't address why these things are happening. So if you address these tight muscles, we want to start to move away from that. You want to learn to connect with your breath again. So I talked about it in sitting, but you can connect with your breath in various different positions. And oftentimes, if you do this either laying on your side or on your back, it's going to be easier for you to be able to feel it. So try it in those positions. It might be easier. And then you'll notice if you unsquish your balloons first, connecting with your breath will be even easier. And like I said, you probably won't feel it the first time. Sometimes it takes a few times for things to actually connect. So really be patient with yourself. Number 3, improve your mobility and deep core strength. So I'm not talking about, like I said in the initial presentation. I'm going to show you a couple different mobility exercises and core exercises in a few. But when you're doing these things, you want to make sure that you're incorporating this breath. This breath is tied into your mobility work. This breath is tied into your core work. And that's how you get the most out of these things. All right, so these are some mobility exercises. If you tried my free mobility guide, you'll likely find these in there, and it's incorporating this breath. Now with mobility exercises, the main thing that you want to focus on is this 360 expansion. So that yes, you're stretching the muscle that you're trying to target, but also using this breath to stretch you from the inside out. With core exercises, our main focus is this exhale. This exhale gets that engagement of those deep core muscles. And yeah, of course, we're going to want to breathe during our core exercises, like duh. But our emphasis on breathing in is into our rib cage while hanging on to the awareness of our deep core muscles. And it's not going to feel like this deep core contraction at every second of the workout when you're breathing, but it's going to fluctuate through some levels of awareness. But the main thing is you're trying to hang on to the sensation of these core muscles when you're doing your core exercises. And I really want to make sure that people get this. It's not just all core. It's not just all mobility. We need both. These things work together. And number 4, we don't just breathe all day. We move. These deep core muscles, your balloons, are connected to everything in your body. Your foot, your ankle, your knee, your hip, your shoulder, your head. All of these things are connected. So when we're connecting with our core and our mobility, we need a total body approach. Your core, your mobility is going to be involved in everything that you're doing throughout the day. When you go to pick up something off of the ground, which is like a deadlift. When you go to lunge to pick up something through your side, which is like a lunge in the gym. When you squat down, when you reach for something in your cupboard, which is kind of like a shoulder press. When you open a door, which is like a row. All of these things are involving your mobility, your core, and all of these things are similar to what you do in the gym. And this is where a lot of people stop. They stop with just mobility work and core work, and they can take you pretty far, but they won't take you all the way, because you'll get to a point where, yes, my core is strong. Yes, I'm able to move very well. But let's face it, we're getting older. All of us are getting older, and we need more muscle mass. So I told you in the beginning, my patients got better with core work, mobility work, and strength training. And the last piece of this is the strength training. And our core mobility needs to be involved in our strength training. All of these exercises here are incorporating mobility work. They're incorporating core work, but they're also working to build muscle mass. We need to build more muscle mass. I'm not saying everybody needs to be a jack bodybuilder. I mean, if that's what you want, cool. But we do need to have some level of this muscle building, this strength training that we're doing in each of our programs. And this is what allows us to be strong and resilient in whatever it is that we're doing through life. So we're able to make it through our day without feeling exhausted. This is what allows us to do all the things that we used to do, that we complain that, oh, I used to be a basketball player. Oh, I used to be a soccer player. I used to be a gymnast. I used to be a dancer. When we do some type of strength training, it allows us to keep doing the things that we used to love to do, that we just talk about right now. This is what prevents us from having pain when we walk up the stairs, when we clean the house, when we do our yard work, because our bodies are strong, so strong. This is what helps us have a healthy amount of body fat because we have more muscle mass. Our bodies use calories more efficiently because we have more muscle mass. This is what allows us to keep weight off because we're not trying to be the smallest version of ourselves. We're not trying to over exercise. We're not trying to under eat. We're actually fueling our body and building more muscle mass so our bodies are strong and resilient. I want you to think for a second. What would you do if you truly loved your body and all that it could do? Your future is based off of what you choose to do today and the series of choices that you make after this. I'm teaching you this so that you could feel your best. We should not have to deal with all these aches and pains. We should have more energy. We shouldn't have to deal with all these random symptoms. We should be happy. We should be sharp. We should be able to look our best so we're confident in our skin. Have a good posture, a healthy amount of body fat, some muscle mass. And we should function at our best. We should be able to do everything that we need to do, everything that we want to do, and show up as the best version of ourselves so that we can achieve anything that our heart desires. I'm teaching you this so that we could show up at our best, whether you're trying to be a mom, whether you're trying to provide for your family, whether you are a busy professional, whether you're a busy entrepreneur, or you're just trying to live your life. I want each of us to be able to have control of our beautiful bodies. And it all starts with a decision. It's up to you. And I want you to know that you can do it. You are not stuck. None of us are stuck. Though there are so many things that we don't have control over. Yes, we got to work. Yes, maybe we got to take care of the kids. Yes, maybe we got some bills to pay or people to take care of. Yes, all of those things are true. But our body gives us so many opportunities to allow it to heal. And what I want you to gather from this is movement is healing. So if you don't even have enough time in your day, you can't make it to the gym. You don't even have to make it to the gym. You could do some workouts at your house. Though you may not have time to actually like get a full workout in, you can do things 2 minutes at your desk. You might have 2 minutes while your baby is sitting there quiet. You might have 2 minutes while you're waiting to get on a call at work. You can do it. And it may not be perfect. And for most of us, it will not be perfect most of the time. But we need to start to take the steps and do what we can within our life every day. All right, I told you guys I would offer you this at the end. This is my 30-day holistic fitness and nutrition challenge. So that was a lot of information, right? I get it. Okay. So what you'll receive is self-massage techniques. So you are able to unsquish your balloons. So some of us don't have access to having massage therapist, pelvic floor physical therapist. And though all of those things are great, if you do have access to a professional, definitely go get that. But some of us don't have that. You're gonna have mobility routines that talk about this breathing so that you're able to see mobility gains for the long term, things that stick. You're gonna get core exercises to strengthen your core, to help that midsection. This will help you actually get that slimmer waist, a better posture, help you take on more in your day. You're gonna get strength training exercises that tie in that mobility work and core work together, and also help you to build muscle in various areas. You're going to receive an upper body workout, a lower body workout, and a total body workout. You're going to receive nutrition habits and lifestyle habits that are going to help to influence everything that's going on in your body. And you're, of course, going to receive my Connect the Body Apps community. So I know you probably have a lot of questions. And within my community, we're going to have a live once a week where I go on and I answer your questions, supported along your journey. And you guys are able to support each other. I made this so that you could feel at home in your body. And what do I mean by that? So every day we go into the world, and eventually we come back home. And I feel like there are so many challenges. There's so many programs out there that you try and you fall off. You try a different one and you fall off. You try a different one and you fall off. I want this to be a program that this is something that you do for the rest of your life. So you're not just hopping off and falling back on a whole bunch of different programs. So it's a 30-day challenge, but it's a challenge in that this is the first 30 days and this is something that you can continue for the rest of your life. This is the foundation of how we move. This is addressing that core mobility. It's helping you build strength. It's helping you build healthy habits so that you're able to support your nervous system so your body's able to heal in so many different ways. So if you feel like this is something that you would like to try, I will drop the link below. And if you're looking for something that's more individualized, or you'd like me to come host a workshop or speak for your organization, I'm going to have you guys go to connectthebodyapps.com. And I want to thank you guys for being on this presentation. I hope you learned a lot about your body. I hope you know what are some steps that you need to take to start to take care of yourself better. Again, thank you guys for joining me. If you want to know anything more about me, follow me on Instagram. My Instagram is Dr. Aisa. I post YouTubes weekly on my YouTube channel, Connect the Body Dots. And hopefully I will see you guys soon. Bye.